is have Dea, our Spanish interpreter, set up language preferences. So we're going to just take a minute to do that and we'll get started.
Thank you. Good afternoon, everyone. Spanish interpretation will be available for you today. This will be able to be provided through a simultaneous feature through Zoom. If you move your mouse, you will be able to see a menu pop up at the bottom of your screen in 1 second once it's enabled. Once it's enabled, you will be able to see a gridded globe, as you can see on the slide on the screen. Click on that gridded globe. The drop-down menu will pop up for interpretation, and then you can click the language and choose the language of your choice. It is important to note that even if you do not need interpretation, you will need to please pick a language so that you are able to hear everyone at all times, including the interpreter. Buenas tardes a todos. Esta tarde vamos a tener interpretación al español simultáneamente disponible. Para poder tener acceso a la interpretación en español, necesita por favor mover su ratón. El cursor va a iniciar que pueda salir en la parte de inferior de su pantalla un menú. En ese menú pueden pulsar en un círculo pueden ver cómo está la muestra aquí en su pantalla. Después de ahí se va a abrir un menú desplegable en donde pueden escoger interpretación y después el idioma de su preferencia. Muchas gracias. Thank you so much.
Thank you so much, Dea. We'll just wait a few seconds here to give everyone a chance to set up their language preference.
Thank you. And I will be adding instructions on the chat in case anyone needs a reminder about how to access that. En un segundo voy a también agregar las instrucciones que acabo de dar al chat por si es que necesitan un recordatorio cómo tener acceso a la interpretación simultánea.
Great. Well, welcome everybody. I'm Susan Caskey. I'm the director for Boulder County Housing and Human Services. Thank you so much for taking some time today on a Thursday evening to join us for this very important topic. We are here for the Supplemental Nutrition Assistance Program and Medicaid information. We have a packed 60 minutes today. We're excited to hear from you all. We're hoping you can post your questions. We have time at the end for you to ask questions as well. I want to just give thanks to our partners, the Colorado Community Health Alliance, Colorado Office of Economic Security, Hunger Free Colorado, and Colorado Department of Healthcare Policy and Finance. A lot of work is being put into trying to figure out the complexities of the end of continuous eligibility and the end of SNAP max allotment. I also want to just give a shout out and special thanks to Susan Gretzmacher for her leadership through all of this and her coordination of this call, to Amy Brune, to Sebastian Fuentes, to Barb Halpin, and Asik Renpal for all of their support and coordination. So since we have a lot to cover today, I'm going to go ahead and turn it over to Susan Gretzmacher to get us started off.
Hello, everyone. Thank you again for joining us tonight. As Susan said, my name is Susan Gretzmacher. I am the Community Support Division Director with Boulder County Housing and Human Services. We have a great group of presenters tonight. So again, thank you for joining us. This meeting is to go over the changes with the SNAP or Supplemental Nutrition Assistance Program and Medicaid, also known as Health First Colorado programs. There is a lot changing all at once, and we recognize that. Our goals are to make sure you have the information you need to be ready and know what other options are out there for supports in Boulder County. SNAP benefits have gone back to pre-COVID amounts, and we want everyone enrolled in the program to know about other resources that are available for food. Also, Medicaid, or Health First Colorado, is resuming recertifications starting in May. We do not want any family or individual to have unintentional loss of Medicaid coverage, and also want to ensure that there is continuity of coverage so that people can have health insurance. We will share what you need to do to recertify your Medicaid as we return to normal renewal processes again. Just a couple quick housekeeping things. Again, if you have questions, you can find the Q&A button at the bottom of your screen. Please feel free to type in information in there, questions as you have them. We ask that you do hold your questions until later in the session. We will have time allotted at the end. And please know that we will not be able to answer every single question, but we will answer the most common questions and where to find information and where to go for more answers. This presentation is being recorded. The presentation links and contact information will be emailed next week. If you have problems with Zoom, you can email us at snapmedsession@bouldercounty.org, and that will be added here in the chat. And we will try to provide information that might help you. Please note, this is only for technical help with Zoom and not for questions about SNAP or Medicaid. Now I am going to turn it over to Carla with our state agency, who will discuss the changes to the SNAP program, SNAP in more detail. Thank you.
Good evening, Boulder County. My name is Carla Marasini, and I am the Division Director for Food and Energy Assistance Programs at the Colorado Department of Human Services. I did want to start by just acknowledging that this is going to more than likely be a challenging time for a very large number of people. The information that we share with you tonight will hopefully not only provide you with some answers to your questions, but then also potentially some additional resources to help during this change. So the biggest thing that is happening to the Supplemental Nutrition Assistance Program is that SNAP households had been getting an extra amount of food benefits since the start of the pandemic. This has been known as either the maximum allotment or emergency allotment, sometimes also referred to EA or COVID benefits. Because of the uncoupling of the public health emergency from this particular component of SNAP, this has ended as of March. So February was the last month that max allotment or the additional COVID food benefits was issued to SNAP participating households. This is considered a mass change. It was nationwide, and it therefore means that it is not appealable. There is unfortunately nothing that the state of Colorado or Boulder County Human Services can do to reverse this decision. This also means that all households will see a minimum of a $95 reduction starting in March. So right now, on average, it will be about $90 per person or $360 for a family of 4. There are a couple of other things to note about this. The first is that you may see a slightly higher calculated benefit now than you did 3 years ago. And that is because the Thrifty Food Plan took effect in November of 2021 and essentially raised the majority of benefits around 21%. Another unfortunate caveat is that you may also see an even smaller amount or calculated benefit than you had 3 years ago before the pandemic if you participate in Social Security. And that is because the cost of living adjustment that took place for 2022 counts as income, and therefore you may see a smaller amount of your SNAP issuance beginning in this month. So one of the things that I also wanted to note is that we have tried very hard to inform all SNAP households of this change. I very much hope that this wasn't the first time that you've heard about this. We did send letters out at the end of January to all SNAP participating households, assuming that we have a correct address for you on file. We have sent text messages and emails for those of you for whom we have addresses and mobile phone numbers. And then we've also done a great deal of social media and mainstream media education on this. If you would like more information about the end of SNAP Max allotment, there are a couple of websites up on the screen. Colorado.gov or cdhs.colorado.gov is our website. It has a great deal of information. You can click through a number of screens to find out more about the end of SNAP Max allotment. I would encourage you to look at your Peak account online if you have access to do so. The bouldercounty.org/SnapMax also has information about this end. And we have a 1-800 number that has been newly launched that is an interactive voice response system that can provide you with real-time information about your individual SNAP case, including your next issuance date and the amount. Once you have verified your identity after you call this number, you can ask the smart bot any question about your case, and it will be able to provide you a real-time answer. If you have pending verifications, for instance, and you need to upload a recent paycheck stub, it will tell you that. So that way there's a seamless issuance of your benefits during this transition. Okay, next slide. Thank you. Other resources that you may want to consider or that you may be eligible for can also be found on the websites. I highly recommend you look at your Peak website if you have access to that. For those of you who are unfamiliar with it or would like to explore it for the first time, Peak stands for Program Eligibility Application Kit, and you can choose a number of different state and county resources on that website and explore what you may be eligible for. Temporary assistance for needy families, also known as Colorado Works, is a cash assistance program for families with children. Low Income Energy Assistance Program is a heating supplemental program. It actually goes all the way back to the beginning of the heating system. So if you are not participating in this program and you apply all the way up until the end of the heating system or heating season, which is April 30th, and you are eligible and can participate, it will actually provide the benefit all the way back to November 1st of 2022. Old age pension is a state-run cash assistance program. And then there are other programs available on Peak that you may want to explore as well. All right. Finally, there are two other changes that you should be aware of. As a result of the end of the public health emergency, which officially ends on May 11th, work requirements for individuals who are considered able-bodied adults without dependents will return as of July of 2023. So this means that if you are between the ages of 18 and 49, and you do not have dependent children at home or another dependent, perhaps an older adult at home, you will be required to participate in some kind of work program in order to remain eligible for SNAP. There is a lot more information about this on our website. It is going to more than likely impact people upon their redeterminations of benefits. The public health emergency related student exemptions will also end. So this means that if you are eligible for work study but not participating in work study, you will no longer be eligible for SNAP based on that alone. And if your expected family contribution of 0 on your FAFSA is how you are currently eligible, that will also end. So while this ends for initial applications filed on or after June 10th of 2023, ongoing households will see this end at your next recertification. So if you have recently recertified, say you recertified on March 1st, you have 6 months from March 1st before this takes effect. And I believe that is all the slides that I have.
Awesome. Well, thank you so much, Carla. And I just wanted to start off by introducing myself. My name is Jordan Lamport. I'm the Applied Policy Coordinator with Hunger Free Colorado. Pronouns he and him. And I just wanted to, start off by thanking Boulder County and all the partners here today who are here sharing information, kind of with all of these federal changes going on within SNAP and Medicaid, and here just to really make sure that these changes are known within the community here. So a little bit about Hunger Free Colorado services. Among the many things we do, we run a statewide bilingual food resource hotline that we would really love to share info about with you all today. who are we? So, we run a hotline throughout that is open to all counties in Colorado, including Boulder County, and we can help you sign up for SNAP either with a new application or help you complete your redetermination through the peak system that Carla mentioned. We are a bilingual resource, but we also over the phone have access to interpretation in over 170 languages. And we're available Monday through Friday, 8 to 4:30 p.m. That's when you can contact our specialists who can engage in the application assistance work directly with you over the phone. Just wanted to echo what Carla already mentioned in acknowledging the moment that we're in and stating that all of these changes that are going on, they're related to a congressional act, and so the state is truly trying to respond as best it can. But with that, there are certainly decreases in benefits that are happening, and we really, as an organization, want to be there to support you, especially if SNAP benefit levels here starting in March are no longer meeting your household needs. We can work with you to help find additional resources that can try and help to mitigate some of the benefit loss from SNAP. So just a little bit about what we can do as an organization, and then what your county is really a better resource for. As I mentioned, we can help you submit an application, a redetermination, change report via Peak, and for SNAP. We can help you with uploading verifications that you might need to submit in order to get your SNAP application processed. We can help you answer questions about the program, so inform you about eligibility, important deductions for SNAP. We are also trained as technicians in the WIC program, and can let you know if your household is eligible or might be interested in applying to WIC, and we can also refer you there. And then we can connect you, like I said, with the school meal and summer meal sites, as well as local food resources. The PEBT program, we can certainly connect you to the 1-800 number that is run by the state and is doing a really great job at answering all questions, PEBT, which stands for Pandemic EBT. And then lastly, as I mentioned, we can help you locate those additional resources like food banks and pantries that are in your area. What we cannot do, sorry, just really quickly on that last side, what we cannot do is approve or deny your application, deposit benefits on your EBT card, actually complete your interview, replace your EBT card, or submit other applications. This is all work that you would want to get in touch with Boulder County for. But if you need any guidance with that, please do give us a call. And our hotline number, which is available 8 to 4:30 p.m., is this 855 number here at the top. So with that, I'm going to pass it over to Susan Gretzmacher, who's going to talk a little bit more about the local resources here in Boulder County. Thank you all.
Hello again. I'm multitasking here. Thank you, Jordan, for that. So again, we partner with Hunger Free Colorado, and they have a lot of various resources and information, so a good source. And for local food resources, we just want to highlight a lot of local resources, in case you are not aware, that are all throughout Boulder County. So really starting at a high level, I do want to go through these as much as it's repetitive to read slides, but talking about Community Food Share. They serve all of Boulder County. Their website's here. They have a pantry. And there's also Sister Carmen, if you're looking at East County, East and kind of South County. Our center in Longmont, Emergency Family Assistance Center in Boulder in the mountains. There's the Lion's Leaf, Netherland Food Pantry, And then there's information here on a couple other programs. So there's Everyday Eats. So there's a link here if you would like to check that out. There's also the Women, Infants, and Children, or also known as WIC program, with information here. This links to the Boulder County site to get information and sign up for WIC. The SNAP application, again, you have heard multiple times, but it's through, you can apply through PEAK. And then the Double Up Food Bucks program. So another great program to really just expand your cash that you have available in a month. So really wanting to check out those programs. So all of the links are here. Again, we'll be providing this out within a week after this evening. This is in here. So this is information on contacting Boulder County Housing and Human Services. Again, we're throwing a lot of information at you. Understandably, it could be overwhelming, but just to reiterate, the SNAP automated information line is here at the top. So it's a 1-800 number you can call to get information. And then for SNAP and Medicaid, there are multiple ways you can contact us at Boulder County Housing and Human Services. So online, PEAK. If you have information, if you have pay stubs you need to get to us, or documents that we have requested to be able to run to determine eligibility on your case, you can email those to imaging@bouldercounty.org. You can also mail those to us, call us. We also have a text line, which a lot of people really like that because they don't have to wait on hold, and maybe a little bit more convenient. And all of these are in both available in both English and Spanish. In person and Longmont, the office is open Monday through Friday. The Boulder office is open Monday, Wednesday, Friday. And then we also have drop boxes at both locations that are open anytime. All right. That is my last slide. So I am turning it over. There we go. To Natalie, I believe.
Actually, it's Sean. So
Sean, thank you, Sean. Sorry.
No worries. No
I
worries.
was like, yeah, thank you.
Good evening, everyone. I am Sean Boddicker. I am the Eligibility Policy Manager at the Department of Healthcare Policy and Financing. And tonight I'm going to cover the changes in regards to the medical assistance programs due to the continuous coverage provision ending. So there on the slide, you can see that for Health First Colorado and our Child Health Plan Plus programs, we will be returning to normal renewal processes within the first notices, with the first notices going out March of 2023 for members who have renewals in May of 2023. This is due to the public health emergency declaration being declared over on May 11th of 2023. So those renewals start for May, but the renewal package, you will start to see them this month. Not all members will be renewed at the same time. So each member's renewal month is going to be established based on their already annual renewal month. So I saw a question in the chat that if you had a renewal last November of 2022, your renewal will occur again this November of 2023. Colorado will take 12 months. That's a total of 14 months. That includes the noticing requirements that we are to do to renew all of our 1.7 million members on our medical assistance programs. It's very important that members pay attention to the renewal notices and fill out all necessary forms, the signature page to your renewal, and any other information that you might be requested in that renewal to make sure that you keep your Health First Colorado and CHP Plus coverage so that we can make sure you're still eligible. So next slide. Beginning with renewal packets mailed out in January of 2023 this year, We have added this red message on the address page to your renewal so that members understand that it is very urgent to reply to this renewal packet. This has been added for all eligibility programs. So that includes the SNAP that you were just hearing about, any kind of cash program that you might have, as well as our medical assistance programs. Next slide, and I think I'm turning it over to Andrea.
Hello, my name is Andrea. I work with Colorado Community Health Alliance, or better known as CCHA. As Sean just stated, that there's a lot of different things happening with Medicaid, and it's really important to stay up to date to receive your reminders. And one way to make sure that you are in the loop for all information updates is to update your contact information. So you'll see on the left side of the slide that you can do that in one of three very easy ways. A lot of people like to use the colorado.gov/peak website. Many people are familiar with that nowadays, but that can allow you to update your contact information in real time. Or if you're more comfortable using the free Health First Colorado app that can be downloaded to your phone, your smartphone. And lastly, as Susan said, you can also get in touch with Boulder County Housing and Human Services directly by calling them at the number listed or by just simply texting. So during this time with the Medicaid renewals, everybody is going to be getting a lot of information for those reminders to make sure that you're taking action at the right time. We at Colorado Community Health Alliance, or CCHA, will be reaching out to you as well. If you receive your primary care in Boulder County, we are your health plan because of the Medicaid insurance that you have. So make sure that you keep an eye and ear out, as we will be sending you text, maybe even an email if we have it on file, making a phone call to you in a different way just to get in touch with you. So next slide. So it's really important to take action on your Medicaid renewal, and that way, excuse me, you can respond by the date in your letter. You're going to get a packet, that renewal packet, either in the mail, or you can receive a notification via email if you're completing it online on that PEAK website. There is a due date of when you need to return that, so be careful to keep an eye out for that. That way you meet the deadline. A good thing to remember is that you do need to sign this document, again, on the hard copy or electronically if you're doing it online. That is a new addition to the process, so make sure that you don't skip that step. And lastly, in order to meet the deadline, please submit your packets as soon as you are able to. Just like updating your contact information, you can turn in your packet in a variety of ways. You can do it online using the website or the app. You can mail in your packet. You can email it to Boulder County, and then also drop it off in person. As Susan mentioned, that they do have drop boxes at both locations, and that way it's more convenient for those who work during the day or second shift. Next slide. Knowing when your renewal date is very important at this time. As Sean was stating, is that there's those changes coming out. We're going to be trying to get in touch with you to provide a reminder of it's your time of the year to renew. Please take action if that is needed. And so that renewal month will help you realize what time of the year you actually need to take action. And so a renewal month actually matches the month that your Health First Colorado or Medicaid or your CHP Plus coverage started. So there was another example thrown out by Sean with the November date, but you'll see on the slide that for another example is if you started your insurance in June of 2022, or if you already renewed last year, you're going to be up for renewal this June in 2023. And so you won't have to take any action until that time frame when you get the packet online or in the mail around May. So if you have questions and maybe you don't understand when your renewal date is actually scheduled, you can again find that online by visiting the colorado.gov/peak website at any time when it's convenient for you. You simply log on and you use the dashboard. You navigate through the page and select the Manage My Benefits section, and then select the overview of health coverage benefits. And therefore, from there, you can find the renewal date for each of the household members. So if you are a parent who is in a partnership, also has children with the insurance plan, you can view their renewal dates at that time as well. Next slide. All right, I'll hand it over to Natalie.
Thank you, Andrea. Hi there, my name is Natalie Coulter. I'm the Communications Director here at the Department of Healthcare Policy and Financing. So I work alongside Sean, and she knows a lot more about the eligibility questions than I do. I work in the communications shop, and I've got to say a thank you to all of our partners who have helped us develop these communication tools. We really appreciate it. Members, health plans like CCHA, our counties, they've all helped us put together these resources. So we're really grateful for that. For members, we want you to know as you're going through this renewal process, where you can go to get help. So online is the quickest and easiest way. Here on the left, the Health First Colorado /renewals page is just a list of all of the information you would need to complete your renewal. What is it? When is it coming? How you can fill it out, how you can submit it, different resources to go get in-person assistance. So encourage everyone to go to that webpage first. There's also a Spanish webpage with the exact same information, if that is your language preference. And then over on the right, you can see screenshots of 2 videos that walk through the same information that's on this webpage. So how do I complete my renewal? How do I send it in? What kind of information do you need to have on hand? The green boxes, what if I don't qualify? What are my options? And I'll talk through that a little bit more on this next slide too. But these are both video resources that you can stop and start as you're going through the process on your own. And then in the bottom right-hand corner, we want to call your attention to this link that has a map of free application and renewal help sites. These are called certified application assistance sites. And you can go here for free in-person help submitting your renewal. There are people there that are trained to help you get through that process. So I'd encourage you to find those sites that are close to you and go there for in-person help. All right, we can go to the next slide now. So what happens if you are not eligible for Health First Colorado, Medicaid, or CHIP anymore? We want you to know that you have options. And if you are a partner, we really ask for your help, making sure that people know that there are options for them. And so here we list out all the different kinds of coverage that a person might be eligible for if they no longer qualify for Medicaid or CHIP. So you might be eligible for coverage through your employer. And if you are no longer eligible for Medicaid or CHIP, you'll qualify for what's called a special enrollment period. It's a fancy way of saying you can get on employer coverage or marketplace coverage anywhere else that you qualify at any time when you lose that coverage. So it's important that you know that you haven't missed the deadline for something. If you no longer qualify with us, you can transition into other coverage at that time. You might qualify for family members' health insurance. This could be a spouse. This could be a parent if you're under 25. You might qualify for coverage on the Connect for Health marketplace. This is the state's official insurance marketplace, and there are people ready to assist you online and in person. You can find more at that link right there. And you might qualify for financial assistance that would make the cost of your monthly premium, that's your monthly payment, lower than it would be otherwise. You may qualify for Medicare. There's a couple of resources right here. One that's Boulder County specific, if you need help seeing if that might be the right option for you. And then if you're a veteran or if you are active military, there are options specifically for you as well. And we want to remind you that if you miss the deadline to respond for your Medicaid renewal, you can reapply if you lose coverage. But we really encourage you, as has been said so many times before, to really pay attention to those renewals, because the goal is to keep as many people with health coverage as possible. We don't want anyone to not have health coverage. And you can view all of these options and this information right here by going to this QR code. That's going to take you right back to our Health First Colorado page that has all of this information in English and Spanish. I'm going to turn it over to Dale to talk a little bit more about the specifics of other coverage options.
Hi, thank you, Natalie. I'm Dale White, Program Manager with Boulder County's Health Coverage Enrollment Center. And as Natalie just said, I'm here to provide more information about some of your options if you are or may lose locked-in Medicaid. We have health coverage guides that provide free, impartial health insurance education, navigation, and application support. If you will not be eligible for Medicaid renewal, we can help you to maintain continuous health coverage. Depending on your income, financial assistance is available to help with costs. To know if you're eligible for that help, this slide is trying to show you some of what that information is about. The first question is whether you are offered job-based coverage. If you are, you're on the blue path. If you are not offered job-based coverage, or if offered and it doesn't meet particular standards, you and your family can enroll through the marketplace, Connect for Health Colorado, and with financial assistance if you're eligible for that. Note that, as Natalie said, there are different special enrollment periods if you're losing your locked-in Medicaid coverage. If you enroll through the marketplace, you will have 60 days before the date of Medicaid loss through July 31st of 2024 to enroll in health coverage on the marketplace. This is an extra special enrollment period because it's not usually like this. And this relates to it being the end of the COVID locked-in situation for Medicaid members. So you have a long time that you can enroll, but we encourage you to enroll as soon as possible so that you don't have a gap in coverage and that you can enroll before your coverage ends to ensure that you don't have a gap in coverage. All right, back to the blue path. If you're offered job-based coverage, the next question is whether that insurance meets the standards that are set forth in the Affordable Care Act and is available to your family members. Most insurance, but not all, does meet those standards of value, which has to do with what those plans cover. Job-based coverage also does need to be affordable for you and your family, or you can shop for marketplace coverage and be eligible for financial assistance. So affordability, this is details, but it relates to your insurance cannot cost you or your family more than 9.12% of your income. If your job-based insurance meets those standards of value and affordability, then you are not eligible for financial assistance through the marketplace. And your best bet is to enroll in job-based coverage. Note that for job-based coverage, you're going to have only 30 days to enroll from the date of Medicaid termination. So the two realities have different, what are called special enrollment periods. All right, the green path distinguishes that some job-based coverage is offered to an employee, but not to their family, or if offered to the family is not affordable for the family. In that case, the employee can enroll in the job-based coverage, but the family is eligible for the financial assistance through the marketplace. So next slide, we're going to talk about what is marketplace financial assistance. I'm waiting for the next slide to load. Thank you. All right. Connect for Health Colorado is our state's official marketplace, the only place you can apply for financial help to lower your monthly premium costs and compare and shop for health insurance plans. Financial help is on a sliding scale dependent on your family's income. For reference, families of 4 earning a little more than $100,000 a year can be eligible for financial help to help pay their premiums through the marketplace. Just want you to have some context. The shape that help takes is through 2 different avenues: premium tax credits, which is an amount the government pays towards your health insurance premiums, or cost share reductions that can lower the cost for deductibles, co-payments, and co-insurance. And on this slide are 2 examples of what a premium, the amount you have to pay for a month to have that insurance, might look like. I want to call out that these are only examples and costs vary depending on the plan chosen, what the plan covers, the number of people in a household, and their income. But what we're trying to depict here is that, for example, in the first family of 3 earning about $45,000 a year, if the premium would otherwise be $1,000, they might be eligible for $668 of tax credits that would reduce that premium cost to being $332 a month. And they'd also be eligible for the additional benefits of cost share reductions. The family on the right, earning slightly more money, is going to be eligible for less tax credits, but still a significant contribution to help those premiums be more affordable. That's what's available on the marketplace for people depending on their financial thresholds. All right, next and last slide. If all of this seems complicated, or you simply would like some help, you can reach out directly to Connect for Health Colorado at the contact information here, or to us at the Health Coverage Enrollment Center. As I said, our services are free and impartial, and you can contact us by phone, by email, or on our website, you can go ahead and schedule an appointment. So we hope that you will take advantage of these resources and work to maintain continuous coverage if in fact you end up losing Medicaid coverage. Thank you. Next, for whoever goes next.
Hello, everyone. Thanks very much for being here with us today, and thanks to all the presenters for the information. Lots of information for sure, and we are also receiving a lot of questions in the Q&A. Thank you for the questions that have been submitted. Many of them have been answered in the Q&A, and there are a few that we want to give an opportunity for our presenters to help answer. One of them is as follows. If you are currently receiving Medicaid benefits, but make more money than the income cutoff, and have only been receiving health coverage due to the COVID extension of benefits, is there any possibility of covered health benefits being retroactively billed in or built in full during the months between May 2023 and your official renewal date? There's a lot of specifics in that question. And so I just would open that up to anyone who might want to take a stab at answering at least part of that.
Hi, so this is Shawn Boddicker again with Colorado Medicaid. If I'm understanding the question again, so my understanding is your income might be over, but we've continued to provide that continuous coverage for you during this public health emergency time. You will remain on until we do that renewal. So as it was explained, if your renewal is set, I believe the example was June, that's when your renewal will happen in 2023. It's based off of when you applied. And so in regards to the second portion, that's where I'm a little fuzzy on the question. If you were on Medicaid during that time, we provided continuous coverage. So anything that you had covered or went to the doctor for during the public health emergency, none of that will be billed to you. You only have copays and very low copays and sometimes deductibles to pay depending on the program that you're on. And a lot of those also were waived during the public health emergency. So I'm hoping I'm answering the second part of the question, because that's where I got a little bit confused, but there won't be any kind of retroactive billing to you as a member if you were on Medicaid or CHB plus coverage during 2020 through 2023 when we start these renewals. I
Thank you,
hope I
Sean.
answered that. Yeah, thanks.
Yeah, thank you very much. Another question is, where can I see my renewal date? Assuming Medicaid.
So the Medicaid renewal date can be found on the PEAK website that we've been referring to. And so that's pretty easy just to navigate that website and check it out. There is also another option. If you do have your primary care here in Boulder County, you can always contact Colorado Community Health Alliance or CCHA, since we are your health plan, and we can give you that information.
Thank you, Andrea.
Thank you.
Here's a question. What if my Medicaid renews in June, but I already got an approval letter that it will continue in June 2023?
Again, this is Sean with Colorado Medicaid. Because I don't know the specifics of your case, it's hard to say why you might have already received a renewal approval letter at this time, because June renewals haven't kicked off. As I mentioned, we've kicked off our May renewals, and those packets are going to be going out this month in March. June renewals don't really kick off until next month in April. And so what I would encourage you to do, I know that Boulder County shared their information. You might want to reach out to Boulder County in regards to finding out what might have occurred on your case.
Thank you, Sean. Again, our Boulder County contact information is reach out via text at 303-441-1069. Here's a question about Medicaid and redetermination. And the question is, will independent contractors be booted from Medicaid upon their redetermination?
So this is Sean again. I imagine when you're saying independent contractors, that's self-employment. And so the answer is not necessarily, and it depends on when you go through your renewal and you provide the information. With individuals that have that self-employment, there are a lot of deductions that we are allowed to take in regards to that income to reduce your total gross income. So again, reach out to your eligibility worker. Please do your renewal paperwork and submit the information that they would need to make the accurate determination.
Thanks very much. Here's a question. Are there any resources to help apply for the Medicaid buy-in program for working adults with disabilities?
I'll jump in here, and I don't know if anyone else, but this is Sean again. On our department website, we have a whole page dedicated to our Working with Adults Disabilities program. And there is a lot of information in regards to the criteria for the program, how you can apply, what we cover, and information in regards to our waiver programs, because with the Working with Adults with Disabilities programs, if you qualify for needing assistance through a waiver, so it may be some assistance, even though you're working, you are working in that program, you might need assistance in your home still, or with some care And so that program does come with some waivered services. And so I encourage you go to our department website. And I think if you just enter in our search function, working adults with disabilities, it'll come up on that page. I can try to look for it and put it in the chat as well.
Thanks very much, Sean. We had a question earlier about Medicare and want to provide the phone number for Boulder County Medicare for everyone. If you need to reach out about Medicare or anything related to it, you can call 303-441-1546, 303-441-1546. Here's a question about Medicare. And so, recognizing we're really talking more about Medicaid during the show here, what if you get Medicare due to disability? It's called dual coverage. Do you still need to renew Medicaid as well?
Hi, this is Sean again. So yes, even though you might have dual coverage, receiving Social Security and that Medicare coverage, for your Medicaid, you will still need to renew to determine if you're eligible for the program that you are on in the Medicaid categories. So please do look out for your renewal and complete that as it's separate from your Social Security work.
Thank you. Here's a question about renewal letters. What do I do if I've not received a renewal letter? The renewal package is not available on the PEAK website either.
This is Susan. Do you want me to jump in? And I would say for us to contact Boulder County, we can pull that up and print or email something off to you so that you have that information. And but just reach out to us again, 303-441-1000 or via text 303-441-1069.
Thanks, Susan. Next question, for those of us who have variable income month to month or year to year and don't necessarily know how much we're making until the end of the year, what amount of a change in income requires reporting for Medicaid in Colorado?
For Medicaid, we take income received in the month or the prior month. And so if you have a ledger that you're keeping in regards to self-employment income is what I believe you're talking about, or seasonal income, you have a pay stub, I would supply that information in regards to your change in income, because we do look at income on a monthly basis. So that's my suggestion. And again, you can always work with Boulder County Human Services.
Great, thanks again, Sean. Here's a question. Is there a set maximum income to be eligible for Medicaid? I'm switching to retirement from SSI next month. I have been hoping to increase my income so I can afford to live alone, but I have $10,000 more and cannot afford to lose my Medicaid even though I have Medicare. So the question there is a set maximum income to be eligible for Medicaid.
So this one's a little bit more difficult to answer. Each program for Medicaid has its separate income criteria that you have to meet, and each one does have a maximum amount that you would have to be under in order to be found eligible for Medicaid. Again, I encourage you to work with Boulder County in regards to your changes in regards to your income so that they can go over the different categories. When you are applying for you said retirement and SSI. There are a lot of programs that we have in the age blind disabled arena, what we call our non-Magi programs, and they have different income and also asset requirements that you have to meet. So I encourage you to reach out to Boulder County in regards to those. And you can also go to the department website. We have information about our programs and the criteria for those programs that you could review.
Thanks very much, Sean. We have just a couple of minutes left. I'm going to get to maybe 2 more questions if we have time. Does a person with autism have to still undergo a redetermination, WAWD, every year, even though their condition will never change?
Yeah, so this is Sean again. We have an agreement, we have rules that we have to follow from the federal government, and one of those is doing a renewal every 12 months for our family and medical populations, also known as our MAGI populations, and for our age blind disabled populations, which falls under the Working with Adults with Disabilities program. And so every 12 months we are to do a renewal to ensure that you still meet the criteria. What I will say on the disability side of that criteria that you have to meet, if you are receiving Social Security, we already consider you disabled. So that paperwork for disability would not be needed. But if the disability is through our state vendor, we do, depending on when your disability was set and when their renewal is set, might need to do that paperwork again. It really depends, but the renewal paperwork does have to be completed every 12 months.
Thank you, Sean. Here's a question regarding Medicaid eligibility. If you're a freelancer and your income could fluctuate above and below the threshold, do you have any guidance on how to handle that?
What I can say is that when your income does change, you are to report that as soon as you know the change. If it fluctuates, we do have a rule where we look at special circumstances in that situation where we could look at annual income. But I really encourage you to work with your caseworker at your Human Services office in regards to those changes.
Thank you, Sean. And thanks to all who have helped answer some of these questions. We know there are many, many questions. We just want to encourage everyone to reach out to the contacts that are available. You can reach out to Boulder County Housing and Human Services at 303-441-1000, or you can text us at 303-441-1069. We will be sending out the presentations from today, and that includes all the links that we've been discussing today, all of the contact information that we've been discussing today, and lots of additional information. That will go out as soon as we can make that available, in addition to a recording of this entire session. So we encourage you to please let others know about this. You'll be able to share the link and the links that we send out after today, and please do so with others who may need to have this information. So I'll hand it back over to Susan Grutzmacher, and we can close out our session.
Again, thank you everyone for attending this evening. We hope that this was helpful, and just really want to acknowledge again that we understand that this is a very difficult time. There's a lot of uncertainty, and we are here to help you. As Jim said, as we've shared multiple times, please reach out. We want to make this as simple as possible for you, knowing that our programs aren't always the easiest to navigate. We are administering federal programs, so we have to follow the federal guidelines for many of these programs, and we are here to help again. So please reach out, and we look forward to hearing from you, and hope that you found this session information session helpful. Thank you and have a great evening.